Hi, if you are having issues with high blood pressure, this video is for you. This is the second episode of the topic I started on the issues about hypertension. If you have not watched the first episode, please try and watch it to ensure you don't miss any information because the information might probably help you out of it. This is your Health Your Life program with Dr. Innocent. In the previous video, I said that arterial hypertension is a big problem to people with hypertension, and that it is one of the main reasons why people with hypertension slump and die, even though their blood pressure is normal, and that you cannot find out if you have arterial hypertension with BP monitor device. Please pay attention. I will start with the reason why you cannot find out if you have arterial hypertension with BP monitor. Arterial hypertension have to do directly with small blood vessels, arterioles, and smallest blood vessels, capillaries. While hypertension or hypotension have to do with large blood vessels, like brachial artery, axillary artery, etc. Large arteries receive the highest blood flow pressure and are also thicker and more elastic to accommodate the high pressure. Now, blood pressure monitor usually reads blood pressure from the brachial arteries, one of the large arteries located in the upper arm, which is the major blood vessel used for measuring blood pressure. When measuring your blood pressure, the blood pressure curve is placed around the upper arm, compressing the brachial artery, which is the one main vessel that supplies blood to the muscles in your upper arm and elbow joint. If using manual device, a stethoscope will be placed over the brachial artery in your upper arm and elbow joint to listen to the blood flow and pulse as the curve inflates and deflates. If using automated device, the curve will automatically inflates, deflates, and measures the blood pressure. These methods can only dictate if you have high blood pressure, hypertension, or low blood pressure, hypotension, but cannot dictate arterial hypertension. And this is because the BP device is designed to use the main large blood vessels that supplies blood to the muscle in your upper arm and elbow joint. BP monitor device is designed to find out if your blood pressure is high, low, or normal. Yes. Don't forget that it uses one of the large blood vessels, brachial artery, to do that, which means whatever level of pressure of blood going on around the large blood vessels, especially, is what the BP monitor will dictate or notice. I'm explaining it like this because many people with hypertension don't know anything about arterial hypertension. And I don't want you to be a victim of its dangerous condition. And for you not to be a victim, you need to have a clear understanding about it. That is why I am explaining it to you like this. Listen carefully. Arterial hypertension, like as I have said, have to do directly with small to smallest blood vessels, like arterioles and capillaries. Arterial hypertension can be detected in anywhere there is small blood vessels in the body, and it can only be detected using scan machine that can scan the entire blood vessels. It can never be detected using BP monitor device. Let me explain further. Your body contains about 60,000 miles of blood vessels. Yes, 60,000 miles. Now, let's convert 60,000 miles to meters for the sake of those who may not understand miles measurements. If you convert 60,000 miles to meters, it will give you 96,560,640 meters, right? That is the measurement of your entire blood vessels put together. And about 10 to 15% of total blood volume is contained in the large blood vessels, arterial system. Capillaries, which is the smaller blood vessels, contain 5%, while veins contain 60%. The capillary vessels are too tiny that the red blood cells can only pass through them in a single file. And it takes around 1 minute for a blood cell to travel all around the entire blood vessels. And it also takes BP monitor device 35 to 40 seconds to measure your blood pressure. Now, during the measurement, the cuff around your arm blocks the blood flow in the brachial artery inside your elbow. As the cuff deflates, the rushing of blood will start flowing again, providing the reading with the upper systolic value first, then followed by the lower diastolic value. That is how the BP monitor device checks your blood pressure. Now, between the 1 minute that a blood cell takes to circulate around the blood vessels and the 35 to 40 seconds of measuring your blood pressure, the blood cells from the capillaries might not be noticed by the BP monitor. Yes. And the reason is because the capillaries contain 5% of blood volume. And apart from that, capillaries are microvessels. They are extremely tiny, measuring about 5 to 10 micrometers in diameter, almost the size of a strand of a hair. That is how tiny the capillaries vessels are. And again, the blood flow in the capillaries is the slowest because of the nature of the work it does in the cardiovascular system. It is not the same flow as in the large blood vessels. So it is difficult for BP monitor to notice blood cell from the capillaries within the short time, 35 to 40 seconds it uses to measure blood pressure. Yes, arterial hypertension cannot be dictated with BP monitor, and it is a very big problem for people with hypertension. It is also a big problem for people with heart issues. You can have hypertension and still have arterial hypertension. Your blood pressure can be normal, yet you can still have arterial hypertension. Let me give you a practical example. Please use your common sense. Have you ever wondered why a hypertension patient will develop a stroke and still have high blood pressure? One side of his body is paralyzed, yet his blood pressure might still be high or normal. Why? Well, first of all, you need to understand that stroke occurs when the blood supply to a part of the brain is interrupted or reduced, depriving the brain tissue of oxygen and nutrients. And within minutes of the lack of oxygen and nutrients, the brain cells begin to die, which can lead to paralysis. So, a stroke is caused by a blocked arteries in the brain. Paralysis can also be caused by a blocked artery, although there are other factors that can cause stroke and paralysis. But I am talking about someone with hypertension who suddenly developed stroke and became paralyzed. We have diagnosed arterial hypertension in the brain of a patient with hypertension who almost developed a stroke. I am talking based on practical experience, not theory. Hope you are following. I need to explain this because what I see and hear on a daily basis breaks my heart, especially when I know there is a solution for the issues. Look at stroke everywhere, slump and pie everywhere. And you think hypertension is only the problem? No, if you think so, you are mistaken. It is beyond that. As a matter of fact, if the entire blood circulatory system of a hypertension patient is accurately diagnosed and scanned, the patient will not develop stroke or slump and pie if adequate treatment is prescribed. Hypertension is just a risk factor of stroke and slump and pie, not the root cause of it. So, if you have hypertension and it is under control, don't just relax. Even though your blood pressure is normal, still go for diagnosis to scan your entire blood circulatory system to find out if you have arterial hypertension or not, to avoid being a victim of slump and die or stroke. Arterial hypertension can be dictated in the brain. It can be dictated in the hand, leg, or anywhere in the body. But remember, it cannot be dictated with BP monitor. You can contact us for your accurate diagnosis. Endeavor to watch the first episode of this topic and subscribe to our channel to get notification when we upload the next episode. I am Dr. Innocent, a holistic physician, servant, and facilitator of nature. Thank you for watching.